At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Dr. Tom here, and we have another interesting program for you, particularly on this kind of cold and damp, and you can't go outside, right? You can't leave the house. You're a little afraid of driving, so you get to talk to me and listen to me. So if you'd like to do that, and by the way, you can always get a hold of me. Just go to drtomroselle.com and send me a note, or go to rosellecare.com. That's ROSELLECARE.com. Hey, listen, want to remind you that, we've changed the format just a little bit. So we do the radio program on WMAL 105.9, and then immediately after, we go into a live stream broadcast where you can see the face with the voice, and we kind of do a little demo, and I get you excited and so forth. But how you do that, you can follow me on any of your social media sites, and we'll immediately let you know as soon as we go live. Additionally, all you have to do is go to drtomroselle.com. So put it up right now, and when we're at the end of the program, you just click in and you're there, and we'll continue the process, and we're going to go from there. What we're going to talk about today, we're going to talk about infections. And they can be diabetic infections, they can be fungal infections, they can be bacterial infections in your feet, and how they affect everything throughout your system. But before we get into that, I want to get into a little bit of something in the news. And, with our good old FDA, guess what happened recently? Some of you already know that the FDA finally banned red dye number 3. Well, they had already banned red dye 40. But guess what? Red dye number 3, as we've been saying for years, that's the red color and, and all kinds of candies and things like that. It's carcinogenic. It will cause problems. So red dye 40, interesting, contains benzene, and it's straight up, nobody can deny it, cancer-causing substance. Red dye number 3 has also been linked to cancer in laboratory testing, but also if you get into the studies and you go into PubMed, you go into Townsend Letter, you go into Nature's Journal and so forth, you're going to see, and particularly overseas, you're going to see all of this this medical information and tremendous amount of studies. And that's, by the way, why they will not allow so much of our food to be brought into Europe, into the EU. The FDA knew a long time ago that red dye number 3 caused cancer. So why in God's name did it take so long for them to get around to saying, no, we're not going to do it anymore? And so that much we know, and it was shielded and so forth, but red dye number 3 will be banned in the United States very quickly. So the decision, and it was finally supported and applauded by, consumer advocacy groups. It's a full 25 years after scientists at the FDA, determined that rats, and we're going back to animals, right, fed these colorings had tremendous amount of problems. They were addictive. The artificial colors addictive, and were more likely to develop malignant thyroid tumors, those cancer tumors of your thyroid. And then, rats that weren't giving these colorings didn't seem to get so bad. Well, here you go. So if they're doing it in rats, I promise you, and they're willing to admit that back then, 25 years ago, guess what? They know about it now. And could it be because there's a guy by the name of Bob Kennedy that is going to start finger pointing. See, I'm the guy that's been telling you all this stuff for years and years, but who am I, right? I'm just this wild voice in the wind, kind of finger pointing at everybody. But when you look at red dye, uh, the dye remained a legal food coloring for years and years and years, and it gives it that red, bright cherry look. The Del Monte's fruit, if you will, cocktail, there's red dye in that. The Nesquik strawberry milk, yeah, there's red dye in that. It's also in beef jerky and fruit rolls and candy and ice cream and other processed foods. So when you understand that, and we know that it's causing all these other problems and ADD and autism and so forth, and the list goes on. Not just the cancer. Everybody says, "Oh my God, cancer, cancer!" But what happens if you can't function? So the announcing this ban, the FDA added that people consumed red dye number 3 at levels far lower than those that were, they're going back those 25 years, that were able to cause cancer in rats. Well, I'm here to tell you that, again, that's their charade. That's the way they manipulate things. The Starburst candy that's out there and the tape candy and so forth. Yeah, that's red dye number 3 too. So, get yourself, on board with all this and make sure you understand it. And maybe we'll spend a whole program. Those artificial rainbow cups that you get for your ice cream, and you put stuff in it, that's red dye number 3. And, if you go through and you look at the side labels, which I encourage everybody to do, you're going to see tons of stuff. Artificial color, yellow dye number 5 and 6, and blue 1, and red 3, and 40. Well, then you see things like canola oil. And I mean, you're a chemistry set that is causing tons of stuff. And you eat this crap all the time. Guess what's happening? You are going to suffer the consequential actions of your silliness. So, check it out, my friends, and we'll get more back to this as we go through over a period of time. I promise you we will, and we're going to start publishing more and more of that. But let's get into the program a little bit. Coming up on the 22nd of January, which is in a couple of days from now, this Wednesday evening at 6 p.m. at the Roselle Center for Healing in Fairfax, Dr. Harlan Browning, the brilliance of this man, the professor, if you will, we're going to be talking about your feet and how your feet affects everything from the neurological system and the skeletal system, and why you have pain, and everybody's been treating everything but your feet. And it may not just be a simple method of putting, orthotics in, going down to, what do they call it? The Good Feet something something shop. And you have to put, all this stuff in your feet and then change it later. And you got to have it for 4 different. What I'm here to tell you is this. The foot is a very, very intricate and important piece. We've talked about it now over the last several weeks, but today I want to talk about, what the deal is with infections in your feet, because foot infections, it can cause all kinds of problems. It can signal underlying health issues, things like diabetes. It's a finger pointing so many times to a diabetic pattern, and sometimes subtle. It can be a fungal infection. We talked about that, and how the toe gets really, really thick and it starts lifting up, and it doesn't look, that's a fungus, and it's coming from inside of you, and it's infecting you, even if it started in the foot because of whatever reason. But we're going to talk about that a little bit more on the live stream today. It's hitting all of you. Or a bacterial infection. Which bacteria? Well, that's the key. There's could be a lot of them there. And if you really go in and you look at infected feet, right? You look it up, going into the images and so forth. I think you're going to get sick to your stomach when you see a foot infection can occur immediately after an injury. And you say, well, I didn't crack anything. Well, you really did at a low level. So it can have a wound in there. It can have a cut, a slight crack, an irritation, things of that nature. And you already got inoculated. I mean, it's there. You washed your feet, you cleaned it up and so forth. But yeah, you already had a problem with it. Now, does that happen? Does that mean you shouldn't walk around barefooted like we talked about a week ago? No, that's not what I'm saying. It means that you can't ignore things. And, by the way, if you do walk around barefooted, we talk about grounding, and we talk about taking care of your feet and rubbing them and soaking them and doing things like that. There's a problem if you don't do those things. But here's the deal. Where do most of these things come from? How about blisters? That means you're wearing things on your feet that are too tight. It's friction from your shoes. It's very common. And most people say, well, that can't be. Yeah, it can be. How about, you go out and you buy these heels, ladies, yeah, I'm going to pick on you again. And the toe comes down really narrowed. No, you're crunching your toes, you're irritating your toes, you're going to have all kinds of problems. So here's what happens. So the infected area, right? You better do something about it. If you see any redness, if you see that ingrown toenail, may not be so much the toenail's ingrown, it's that the foot itself was irritated and now the nail is getting compressed. But the warmth and the redness around the blisters, those are signs of infections. So instead of this this clear fluid, an infected blister may become filled with yellow greenish pus, and sometimes you don't see it until you poke it, and then all of a sudden this oozing of this greenish stuff comes in. And then how about at athlete's feet? We said, well, yeah, you got athlete's feet, that's the cracking between and the blisters between your toes and so forth. But are you going to ignore that and just go get some powder and put it on there? By that time when you see that, it's already inside. And the smell of your feet really don't smell bad unless you got an infection or athlete's foot or something like that. You had a little sweat, but so many of us are being told now we stink all over, when we have to put these powders and these creams on everything about our body. Not so much. There's a natural smell, particularly if your body is clean. What do I mean by that? You eat well, not all the crap that you go in your fast food stuff. But if you drink a lot of water, clean water, and you eat well, organic and non-GMO, and you don't put all the sugars in your system to feed the bacteria and feed the fungus and things like that, guess what happens? You don't smell. You really don't. Your mouth only smells bad if you got an infection in your tooth. And that's because you're not taking care of yourself. You're not, eating well. You're not clearing it out. You're not flushing. I'm not saying going out and get, all these gargles that you have to get. But so here's the deal. If you have a light level fever, it's a common symptom of infection. A fever can also make you feel kind of lousy, lethargic, and cause your body to ache all over the place, and you don't know why. So you start taking what? You start taking all the NSAIDs, the non-steroidal anti-inflammatories, your Tylenol. You're going to start taking, Advil. You're going to start taking Motrin. You're going to start taking over-the-counter whatever, and you think that's going to help it. No, it continues to perpetuate. It's not doing anything for the infection. It's just dumbing it down, so you're not being aware of it. People with diabetes have a tremendously increased risk of foot infections. Over time, high blood sugar can lead to damage in the skin and the blood vessels. We've talked about that now over a few weeks. And the nerves, we talk about diabetic neuropathy. There's also central neuropathy and peripheral neuropathy. And, we did that. I'm going to touch a little bit on that Wednesday night. So make sure that you register. And just as a sidebar, go to rosellecare.com or go to drtomroselle.com and register for the class. And make sure, please, that if you do come, pay attention, because this one could save your life. It really could. Just, be there with us. All right. And then the other piece is that if you're not going to come, then give us a call so we can have room for somebody else. So here's the deal. We talked about diabetic depends. So these ingrown toenails that I touched upon a little bit, this can happen when mechanically, if your shoes are way too tight and if you don't trim your nails properly and so forth, that's one reason for it. But that ingrown toenail can be secondary to an infected area that you're not paying attention to. How about warts? Did you know warts are an infection? Yeah, they are. What are they? They're a virus. So you get a wart on your foot. That means you got a viral pattern that's going on throughout your body. And by the way, I'm going to give you a way to get rid of that and some of the things that you can do to fix that if you come on Wednesday evening. I promise you, warts can be eliminated. We get kids, we kid around, we say, yeah, you're a little warty kid. Well, these papillomaviruses, if you will, they enter the body in different areas, and they're through cracks and cuts, and it can happen in your feet because if you're not taking care of your feet. Again, it's not about wearing shoes. Again, it's about doing the wrong things. It's not, it's about taking care of them. What happens if you go out and stub your toe outside? Well, the first thing you do is you go in and you wash your foot and you put a little disinfectant on it. What's a good one? Hydrogen peroxide. It'll knock out virtually any viral pattern. You know, during the pandemic, I had a bottle of peroxide, hydrogen peroxide in every room. And I didn't go wash my hands with hot water and soap. What I did is I took the peroxide and I sprayed my hands every time I got done treating a patient. And then we had things of that nature to wipe everything down, and Clorox will do it and so forth. But I use peroxide on my hands because that will kill the viral pattern. So we'll teach you a few things like that you can do to protect yourself and make a huge difference. But foot infections can be significant. What happens if you get a puncture wound? Well, a puncture wound can be problematic, and it can give you, tetanus and so forth. I had a good friend of mine, a medical physician. Everybody wants to go out and get the tetanus shot to prevent you from, and you got to have it every 10 years and so forth. Well, not so much. And those are for people who are not anywhere near a hospital. But here's the deal. If you get a tear in your foot, something happens, you act now, and you can get a shot then, and it works just as quickly. But if you don't, why put that stuff in that's going to bind your immune system? But you should have at the house, right? You should have things like antifungal creams. You should have an antibiotic cream. You should have peroxide, with you. You should have blister pads and, things of that nature. So when something happens, you take care of it. But did you know that if you don't take care of your feet, you ignore a diabetic infection, you can end up these ugly ulcers, the foot swells, cellulitis, the bacterial infection goes through the ceiling. Now you got a problem. Let me tell you another piece of the puzzle. Let me tell you what else can cause a injury to the foot. It's called gout. You can have an underlying gout, and all of a sudden you see the foot starting to swell a little bit. And you could have a problem with your kidneys. Why? Because the kidney energy, the channel starts in the feet. And you could have this overall swelling that occurs, and you say, oh my God, what do I do? What's a sign? It's finger pointing. It's telling you that you better pay attention to it. And if you don't pay attention to it, you're going to be in trouble. It's going to end up with all of these things. So there's a lot of different ways. Did you know that eggplant can get rid of a plantar wart? That's an old, grandmother's cure, right? So you take the eggplant and you slice it in about, half an inch thin slices. You put it in a glass tray overnight, put a lot of salt on it, cover it, and let it sit there. Next morning, they're going to be really soft. So you take them and you squeeze the juice, into the bowl, get rid of the eggplant, and then use that liquid to dab it on the wart and cover it with a gauze pad and soak the gauze pad. And guess what happens? It will kill the plantar wart over time. Here's another one. If you take chapstick and you put the chapstick and seal the wart, and then you do it every day. You make sure you keep it covered. You don't let anything get the chapstick off of it. You know what that'll do? It starves the wart from oxygen. Warts are aerobic. And so they want that oxygenation. If you starve it, when it happens, plantar wart, it turns black and it falls off. Interesting stuff, huh? So, see, I'm giving you a lot of little things very quickly, so you don't have to go, do the surgery. And there's other things that I'll save to Wednesday night, and I'll give you some more ideas when you join us. But remember, anytime you have something on your foot that is an infected pattern, or your foot even mechanically is not working the way it's supposed to, or the arch is dropped, it's going to affect everything all the way up from there. It's going to affect your body's balance. It's going to cause headaches. It's going to cause spinal pain. Now those things are there. Now you got a secondary problem you got to fix on top of that. So let's find out really how to treat your feet. Our orthotics may be appropriate, but then there's a lot of stuff if it's too long that you've got to do more about that. So I promise you, we're going to really give you a ton of data this Wednesday evening, the 22nd. Please join Dr. Browning and I, and we'll really get into this. It's important. There's tons of data out there, and what I want you to do is I want you to be critical thinkers. I want you to be able to think through the process, ask questions about, is this real or is it not? And that's the same question you should ask when you're listening to the program. Is Dr. Tom telling me the truth? Or is he kind of playing? I don't know, but here's some more information. When you have a swollen foot, it can also be an indication, or if there's an infection in your foot, it could be an indication of heart, liver, kidney problems, major organ systems, right? Swollen ankles at nighttime can be a result of sodium chloride, the wrong type of salt. I tell patients to take, Celtic salt every day. Put a little Celtic salt on your food. So, well, I'm not supposed to eat salt. Well, not so much. When it's Celtic salt, it's got 74 trace minerals. You're not doing a lot of it in due for. So, but remember that salt, if it's the wrong kind, sodium chloride, that's all there is there. There's nothing more to it than that. It holds on to water. But when it has the other trace minerals in it, it doesn't do it like that. So, but we have to make sure that we're aware that the feet infections, the swelling can cause all kinds of problems. We're going to talk about that more on the live stream. We're going to, kind of drive that home so you really get it. The health conditions, poor circulation, there can be all kinds of red flags that are going up that we ignore. We just, how often do we put stuff off? It's like, really? So listen, we're coming up to that type of the program right now, and we have to make sure that you have the data, you have all the information that you're going to need to protect yourself. We're going to talk about 15 causes of treatment when it comes to your feet, swollen feet. Just a little bit. We'll touch them. We're not going to hit them all. We don't have time to hit them all. But I'm going to give you things that will make a difference. But we're coming up to that time of the program, and follow us right now. Go to the live stream, drtomroselle.com. And remember, I'm here every Sunday for one reason only, and one reason at all. I love you all. You deserve the information. That's why I keep doing what I keep doing, and that's why I get in everybody's space, if you will. Follow me to the live stream. Let's go.
Breast cancer is a major health risk to all women. It can
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Foot Function and Skeletal Health on Wednesday, January 22nd at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.
you.